Hi, good morning. My name is Estisel. I'm a third year medical student. May I know what's your name?
Bruno Chen,
Okay, and what's your date of birth?
4th of December of 1994.
So how old does that make you?
22.
Okay, so do you mind if I call you Bruno?
Yeah, sure.
Okay, so today I'm going to examine your eyes, nose, mouth, ears, as well as the muscle in your face and neck. Would that be okay with you?
Mm-hmm.
Are you in any pain right now?
No.
Okay, that's good. Okay, I'm going to do a general inspection. So on general inspection, the patient seems comfortable. There's no signs of any distress. There's no facial asymmetry, no muscle wasting, no fasciculation. There's no ptosis, no strabismus, and there's no medical aids of hearing aid, glasses, or eye patch. So I'm going to load a bed, and could you sit inside the bed, please? Okay. I'm going to test for your sense of smell now. Have you noticed any change in your smell recently?
No.
Do you have any blocked nose?
No.
Okay. So I'm going to test for your sense of smell. So to do this, could you close your eyes and cover your left nostril? And I'm going to put some common item at your right nostril and tell me what you think it is. What do you think it is?
Coffee?
That's good. Okay, could you do the same but cover your right nostril instead? Okay. Let me know what you think it is.
Coughs?
That's correct. You can relax now. And so the olfactory nerve is normal. Bruno, so now we're going to test for your eyesight. Have you noticed any change in your eyesight recently?
No.
Do you wear any glasses?
No.
So now I'm going to test for your eyesight.
Okay.
Okay, so now I would like you to close your left eye and read this chart from top to bottom. Do let me know when you can't see the words anymore.
ELTFPHOLC.
Good. So the patient has a visual acuity of 20/20. Ideally, I will do the same for the left eye, but due to time constraints, I'll move on. Could you cover your left eye and read this for me, please?
Hold chart 6 feet from eyes in good light. Check eyes separately, both with and without glasses. Chart based on a visual angle of 1 degree.
That's good. So the patient has normal near visual acuity. Ideally, I will do the same for the left eye, but due to time constraint, I will move on. Okay, now, could you cover your right eye? Gently, don't press it, and just look at my eye. I'm going to move this pin at the side and say yes whenever you see it.
Okay. Yes. 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 Yes.
The peripheral view is normal. Ideally, I'll do it for the right eye, but due to time constraint, I will move on. Bruno, could you cover your right eye again? So look straight in my eyes, same as just now. This time, I'm going to put this red pin like from the side. Say red whenever you see this pin turn from black to red. Okay. So
Red. 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 Red.
the central vision is normal. Ideally, I'll do it for the right eye too, but due to time constraints, I'll move on. So now I'm going to do the blind spot test. So you could do the same as just now. Cover your right eye and don't press it, and look at my eye. So I'm going to move this red pin around and say now whenever you see the pin disappear.
Now. Yeah.
Does it disappear?
Yeah.
Does it reappear?
Yeah.
Does it disappear?
Yes. Appear again. Disappear. Appear again. Disappear.
Okay, so the blind spot's normal. So ideally, I will do the same for the right eye, but due to time constraint, I'll move on. So moving on now, I'm going to test for pupils. On general inspection, there's no ptosis, there's no asymmetry. And the pupil size is 3 millimeters. So, Bruno, could you look at the clock behind me? I'm going to shine a light at your eye to check whether your pupils will constrict. Okay, Bruno, could you put your right hand between your eyes and just at your nose bridge and look at the clock behind me? I'm going to shine the light at your eyes. Okay, I'm just going to do the same for your right eye. Now I'm going to check for the consensual response. Same for the other eye. Consensual responses is present in both eyes. Okay, I'm going to test for the swinging light test now. So I'm just going to shine a light here. You can rest your hands now. There's no relative afferent pupillary defect. Okay, Bruno, could you look at the clock behind me? And to the tip of my finger. To follow my finger. Okay, very good. Accommodation reflex is normal. Have you experienced any double vision lately?
No.
Okay, could you look at my finger and don't move your head? Just follow my finger movement. Okay. Pursuit is normal. Okay, Bruno, could you look at my pen and my hand without moving your head? So pen, hand, pen, hand, pen, hand. There is normal saccadic eye movement. Now I'm going to test for the fifth cranial nerve, the trigeminal nerve. So I'm going to test for your facial sensation as well as your facial muscles. Have you noticed any changes in your facial sensation?
No.
Have you noticed that your hearing has been louder than usual?
No.
So now I'm going to test for your facial sensation. So this is a cotton wool. Yep. I'm going to put this on your face, but for reference, I'm going to just touch on your chest first. Do you mind if I put on your shirt?
Oh yeah, sure.
So this is how it feels like? Do you feel it?
Yeah.
So could you close your eyes? And say yes whenever you feel this cotton tip touching your face. Ophthalmic.
Yes. Yes.
Maxillary.
Yes. Yes.
Mandibular.
Yes. Yes.
Open your eyes. Does it feel the same on both sides?
Yes.
Okay. So now I'm going to test for your sensation of pain. So this is a pin. This will be the sharp side, and this will be the dull side.
Okay.
So just going to touch your chest with this so that you know how it feels like.
Okay.
Okay, this is going to be sharp.
Okay.
Do you feel it?
Yes.
This is going to be dull. Can you feel the difference?
Yeah.
Okay, so could you close your eyes again and say sharp or dull whenever you feel the pin touching your face?
Okay. Sharp. 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 Dull. Sharp. Dull.
Open your eyes. So does it feel the same on both sides? It's good. Now I'm going to test for your sensation of temperature. So this is a cold tuning fork. I'm going to put this on your chest so that you know how it feels like.
Okay.
So, do you feel that it's cool?
Yeah.
Okay, so could you close your eyes again? And say yes whenever you feel the tuning fork on your face.
Okay. Yes. 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 Yes.
Open your eyes. Does it feel cold?
Yes.
Does it feel the same on both sides?
Yeah.
Light touch, pain, and temperature are normal. Now I'm going to test for your facial muscles. Have you noticed any difficulty chewing?
No.
Could you cleanse your teeth, please? Relax. Could you cleanse your teeth, please? Relax. There's normal muscle bulk and no muscle wasting. Could you open your mouth for me, please? I'm going to push against your mouth. Don't let me close your mouth. Okay. Could you continue opening your mouth and move your jaw to your left? Push against my hand. That's good. Could you do the same for the right side? Push against my hand. Okay, you can relax now. Okay, that's good. So the maxilla and temporalis have normal bulk, there's no muscle wasting, and your muscles and mastications are normal. So I would offer to do the corneal reflex and the jaw jerk reflex. Okay, now I'm going to test for the seventh cranial nerve, which is the facial nerve. So in this, I'm going to test for your facial muscles. Yeah. So on general inspection, there's no facial asymmetry, there's no widened palpebral fissure, there's no flattened nasal labial folds, and there is no involuntary facial movements. So can I ask, have you noticed any changes in your sensation of taste?
No.
Any difference in your facial expression?
No.
Any dry eyes?
No.
Or dry mouth?
No.
Okay, I'm going to test my facial muscles now.
Mm-hmm.
Could you lift up your eyebrows for me, please? That's good, you can relax them. Could you close your eyes as tightly as possible? And don't let me open your eyes. Okay, that's good, you can relax them. Could you show me your teeth? Okay, that's good. Could you puff out your cheeks for me, please? Okay, don't let me push the air out of your mouth. That's good. Could you press your lips as tightly as possible together? And don't let me separate your lips. So you can relax them. So the motor aspect of facial nerve is normal. Ideally, I would offer to test for the sensation of taste, so I'll give something sour, sweet, salty, and bitter. So now I'm going to move on to the 8th cranial nerve, which is the vestibulocochlear nerve. So have you experienced any changes in your hearing?
No.
Have you experienced any loss of balance?
No.
Okay, now I'm going to test for your sense of hearing. I'm going to whisper some numbers in your right ear and then make some noises in your left ear. And then repeat the numbers after I've told them. So
2, 4, 6.
it's good. I'm going to do the same for the other ear.
1, 5, 7.
That's good. Now I'm going to put this tuning fork behind your ear. And then say now whenever the sound stops. And then I'll put it in front of your ear. And let me know if you can still hear any sound.
No.
Do you still hear the sound?
Yes.
I'm going to do the same for the other ear.
No.
Do you hear the sound?
Yeah.
That's good. Okay, so Renee's test is normal. Now I'm going to put this tuning fork in the middle of your forehead. Yeah. Does it sound the same on both sides?
Yes.
That's good. Weber's test is normal. So, if the patient were to experience vertigo, I would perform the Hallpike's maneuver. Now I'm going to test for the 9th and 10th cranial nerve, which is the glossopharyngeal and vagus nerve. Have you noticed any difficulty swallowing?
No.
How about any hoarseness in your voice?
No.
Could you open your mouth as wide as possible? And say ah. Can you close your mouth? There's symmetrical elevation of your palate. Could you say ka ka ka?
Ka ka ka.
Go go go.
Go go go.
And pa pa pa.
Pa pa pa.
There's normal palatal, guttural, and labial articulation. Could you swallow for me, please? Okay, there's normal swallowing. Could you cough for me? Thank you. There's no bovine cough. So I would offer to do the gag reflex. And now I'm going to move on to the 11th cranial nerve, the spinal accessory nerve. So on general inspection, there is no asymmetry or muscle atrophy of your trapezius or sternocleidomastoid muscle. So could you lift up your shoulders for me? Don't let me push it down. Okay, you can relax now. Okay, could you turn your head to the left and push against my hand? That's good. And do the same for the right. Push against my hand. That's good. You can relax now. So trapezius and sternocleidomastoid muscles are normal. So now I'm going to move on to the 12th cranial nerve, which is the hypoglossal nerve. So could you stick out the tongue for me, please? There's no fasciculation, there's no muscle atrophy, no hypertrophy, and there is symmetrical protrusion. Okay, you can put out your tongue. Could you move your tongue to your left cheek? And to the right? Could you move left and right as quickly as you can? Okay, thank you. So, the hypoglossal nerve is intact, and I've concluded examination. Okay, you can sit back. Okay, so thank you, Bruno.
Thank you.
Okay, I'm going to report my findings to the consultant.
Okay, thank you.
I've concluded a normal cranial nerve examination of Bruno Chin, a 22-year-old male. So for cranial nerve 1, there's normal sense of smell. Cranial nerve 2, there's normal visual acuity and visual fields. For cranial nerve 3, 4 and 6, there's normal eye movement with no nystagmus. For cranial nerve 5, there is normal facial sensation and muscles of mastication. For cranial nerve 7, there is no facial asymmetry and there's normal facial expression. For cranial nerve 8, there's no lateralization and air conduction is better than bone conduction. For cranial nerves 9 and 10, there is symmetrical elevation of the palate, normal swallowing, and normal articulation. For cranial nerve 11, there is normal trapezius and sternocleidomastoid muscle. For cranial nerve 12, there is normal tongue bulk and strength. So to follow up, I would conduct a neurological examination of upper and lower limb as well as a CT and MRI of the brain. Thank you.